Good morning, everyone. We're just going to give everyone a couple minutes to trickle in, and then we will get started. Well, good morning, everyone. Welcome to the first ever panel hosted by Care+Wear, focusing on the future of healthcare. Really appreciate your taking the time to join us today, and we're excited to kick this off. My name is Razdan. I am the founder and CEO of Care+Wear and moderator of today's discussion. I started the company in 2014 after having loved ones diagnosed with cancer told to wear tube socks over their PICC lines. As I saw them wearing a tube sock on their arms, I thought, wow, this really stinks. There must be something better. And with that, Care+Wear was born. And so too was our mission to bridge function and fashion to create a more human healthcare experience. In creating all of our products, which range from things like the infamous hospital gown, focused on no longer exposing your backside, to NICU onesies, the chest access shirts, post-reconstructive surgery bras, and our most recent collaboration with the Notori company to create scrubs for our frontline workers. We work with an incredible network of clinicians, patients, designers, manufacturing partners, and others to make sure that each of our products are medically superior, functional, and comfortable. And we are focused on helping to advance the field of healthcare and improve patient outcomes. The COVID-19 pandemic over the last 18 months has taxed our healthcare system like never before and brought to light the numerous challenges within its infrastructure that need to be addressed. As the country begins to reopen, we are bringing together leaders in healthcare to discuss what the pandemic has taught them and how those learnings are going to help reimagine the future of healthcare. This is particularly timely as frontline healthcare workers continue to share their stories of trauma and stress from the pandemic, and we in the industry are charged with innovating ways to improve the healthcare experience for all those touched by it. So without further ado, I want to quickly introduce our panelists. Paul Coyne serves as Clinical Practice and Chief Nursing Informatics Officer for the Hospital for Special Surgery. He maintains administrative oversight of advanced practice nursing, clinical informatics, occupational health, and other operational areas. He's licensed as a nurse practitioner in the state of New York and holds a BA in American Studies from Providence College, a BS in nursing from Columbia University, a Master of Science in Finance from Northeastern University, an MBA in Healthcare Management from Northeastern University, and both a Master of Science in Nursing and a Doctor of Nursing Practice from Columbia University. Thankfully, my mom has never met him because otherwise she would ask me why I haven't gone to school as much as he has. Next up, we have Esther Kwon, who currently serves as the Chief Operating Officer for St. David's Medical Center. Previously, she held the positions as Assistant Administrator and Associate Chief Operating Officer at St. David's Medical Center. During her tenure, she has overseen over 400 employees and an operating budget of over $65 million, facilitated the planning and execution of major construction and expansion projects, and led the addition of new service lines and physician partnerships to support the needs of the facility and the community. She earned her Bachelor of Science in Health Policy and Administration from the Pennsylvania State University in University Park, Pennsylvania, with a minor in economics, and she received her master's degree in healthcare administration from Trinity University in San Antonio, Texas. And I forgot to ask her thoughts on her favorite restaurant in Austin, but I'll be sure to bring that up during our panel. Finally, we have Greg Weingart. Dr. Weingart is an emergency physician with Emergency Physicians of Tidewater in Norfolk, Virginia. He is a clinical assistant professor of emergency medicine at Eastern Virginia Medical School. He is the assistant medical director at Centara Norfolk General Hospital, which is the regional tertiary care center for coastal Virginia. He, in his spare time, is also an advisor for Care+Wear and one of the reasons that I have now started running. He graduated with a BS in biochemistry from the best college in the world, the University of Virginia, in 2005, and holds an MD from the Eastern Virginia Medical School. He's also well known for the time that he used to spend in libraries around Charlottesville. So first and foremost, I'm going to open the discussion with questions for everyone and a few specific ones for each of our panelists. But we want this to be a discussion, so please jump in if there's anything you'd like to add. As well, we have a Q&A section where you can post your questions for me to ask the panelists during this time. So first, I'd like to start with a question for everyone. Can you share your experience during the pandemic? There have also been daily updates about the Delta variant. How is this impacting you, and what have you learned in the last year and a half, and how can we be better prepared for this next surge? Greg, why don't we start with you?
Thank you, Chad. Thank you for that introduction. That's a multifaceted question. So how has COVID affected me? I guess I'll break it down into different parts. So I'm an emergency doctor. I work in several different emergency departments, and it was definitely interesting about 18 months ago or so when we could slowly see the spread of COVID kind of starting in Wuhan, China, and then as it slowly matriculated into the US. And it was interesting to see how the hospital prepared and how our staff prepared for it. It was interesting when it started in March, across the nation, we saw kind of emergencies stop coming to the hospital. As an emergency doctor, there's a fixed rate of folks who have heart attacks, appendicitis, and whatnot. And all of that kind of dropped off because people were afraid to come to the hospital. I think there was a really good messaging that came out kind of a couple months or a couple weeks later showing that it was safe to come to the hospital. We set forth lots of different practices and procedures to make sure that people were safe if they had to come to the healthcare environment. Now, Chad, I forgot the other question.
So not only how it was, but kind of what you've learned in the last year and a half so that we can be better prepared as we continue to live with this, as well as potentially future outbreaks of other.
Sure. I mean, how we can prepare as an emergency doctor, I think this is kind of, when this started, there was a little bit of nervous energy, at least in my group. I'm guessing ER doctors across the nation. This is kind of what we train for. This is what we prepare for. We like the unexpected, and we like the non-mundane kind of shifts that we have. So I think a lot of the folks in my group, I speak for my profession kind of across the US, had some nervous energy kind of going into this. And I think we've realized how to thrive and kind of move through it. There's been some ups and downs. There's definitely been some, I think, anxiety. I know personally when this started, I went from typically I would wear a dress shirt, dress pants, and look nice on my shifts. And I switched to scrubs because in the beginning, we didn't know if we would take this home to our family. And there was, horror stories in the beginning of folks bringing it home and getting their family sick. And as a father with 3 kids, that was something that kind of weighed on my mind. So I think we've seen a pivot in kind of how we dress and how we acted at work. At our work, we're still masked, and a lot of me and my colleagues kind of talk about when or if that will ever end. And I don't think any of us truly have the answer. This Delta variant, we're starting to see an uptick in my area of hospital admissions and such. So I think we'll just see what the future kind of holds with respect to kind of going forward in the future. And what is this kind of taught us? I think there's been definitely, I feel at least in society, people refocusing on their health, realizing that things are fragile over the last 18 months or so. And I know personally between my friends, family, and colleagues, I have seen a lot of people take a more interest in their health and trying to actually see physicians and trying to get back in shape and such, which I feel like before that point, people had a little bit more laissez-faire attitude and such.
Great. Paul, do you want to share what the pandemic was like from the nurses' perspective? I know here in New York, everyone was clapping outside of their window for you and your team and all the frontline workers out there. But would be interesting to hear about it from your perspective, as well as kind of as you oversee nursing operations, anything you're planning on changing now as compared to before.
Yeah, I think that the clapping out the window at 7, I know they did that all around the country, the world, but in New York, it's such a condensed space. So that really was magnified in terms of feeling that impact, as you walked home or having dinner and listening out the window. So, 2020 was the year of the nurse, the World Health Organization said that it was the year of the nurse. And now they've extended it into 2021 because we kind of got, a lot of focus as much as we should have in terms of the great impact that a nurse can have on society, which was the focus of the original designation, but really the heroic response of the frontline caregivers, nurses, doctors, everybody on the front line, I think got all the attention, and rightfully so, because it was just remarkable to see people step up, and really saw the best in humanity at the same time as you saw, some horror, which is typically how unfortunately things go, but you do get to see the best of humanity rise to the occasion in circumstances like that. And so I think that, now taking that platform of attention and magnifying other things that nurses particularly can do for society, be it business, political, IT, tech development, any of these things, to really take that platform and use it in a way to have broader impact beyond the bedside. So that the bedside is also then, it's a circle, so that the bedside is then more impacted and there's better patient care, I think is where nursing needs to go, both at the macro level and then at the micro level here at the hospital too.
Great. Esther, can you speak about this from an administrator perspective? Has your role changed? And if so, how? And are you considering making changes to your internal systems moving forward?
Sure. I would say in regards to my position I've always been in operations and I've always implemented. I would say what's changed is us having to turn off and turn on the entirety of a hospital operation at unprecedented speeds. And so collaboration and communication with our frontline staff, with our stakeholders, I think became more important than ever. And then all doing it while limiting in-person interactions, I think makes it challenging. Healthcare is a very human and interrelational business, and so doing things virtually, I think, changed the nature of how we execute across the hospital. In terms of making changes to internal systems, it definitely has created systems for us in terms of how you mobilize COVID-specific beds, cohorted areas for for patients. Those are all systems that we made changes around during the first wave that we're actually leveraging currently. And then I think just how you control patient flow into the hospital. For most hospitals, we get a lot of patients that are transferred in from external communities, sometimes as far as 200 miles away. And I would say we have instituted systems to make sure that our resources are available for our direct communities. That again, we are utilizing and refining now with the Delta variant coming back.
No, that is super great to hear. And I think that there's so much left to be done, and it's a scary unknown future. And we really appreciate the work that all of you and your teams are doing. Before I go into the next question, I just want to remind people that if you have any questions that you would like me to ask, please feel free. At the bottom of your screen, you should see a Q&A button where you can actually input any questions that you might have. Something that's near and dear to our heart, and one thing that we've heard repeatedly from our hospital partners forever, but especially over the last year and a half, and seen firsthand with people going into the hospital, is patient experience. And obviously, first and foremost is protecting everyone in the hospital. But as we come out of the pandemic, hopefully knock on wood sooner rather than later, how do you and your teams hope to innovate and improve the patient experience moving forward?
I can take the first question here. So, with COVID, our infection control team basically really looked to reduce and limit interaction. So when folks came into the hospital, it was just the patient that was allowed back. Their loved one's support system, unfortunately, were kind of asked to remain even outside in their car as a hope to kind of limit everyone's interaction. In the beginning of all this, we were uncertain as to how infectious and how easily this could spread. And this caused a whole host of different issues as well. And we all recognized that that the patient experience definitely kind of was hindered by not having their support staff there. And I will say, as an ER doctor, I was routinely calling and updating families, often FaceTiming with families to try and answer everyone's question kind of all at once. And we all recognized that it wasn't ideal. If you had asked me this question 3 weeks ago, before COVID started to creep up, I would say there'd be a big kind of push again towards the patient experience and bringing families kind of back to the bedside to kind of help improve that support structure for healing and such. We will see kind of going forward the different hospital responses when folks are, if loved ones are vaccinated or not, whether they're allowed to be kind of staying, which I think time will tell and what the CDC kind of recommends. But there's definitely a big push to kind of help improve that experience, especially over the last 18 months or so.
Yeah, we dealt with the same thing, I think, Greg, you guys did. And there's no perfect answer, especially in such an emotional state for patients where you actually need your support system. And so we were as gray as possible to try and meet the needs of our patients and their loved ones, but honoring infection control practices. I would say what changed for us is we tried to figure out ways to maximize the efficiency of the process of the patient from coming in to getting out. We made huge transitions for surgical patients that could be done on an outpatient basis that historically that were being done on an inpatient basis, making sure the patients receive that same level of care with a more rapid speed through the hospital system than they previously had.
Yeah, I think just to echo those statements, and I think the paradigm of shifting completely to telehealth for everything, as was necessary in the pandemic, had great benefit in many ways. But sometimes in person has benefit, as we just alluded to, with the caring environment around the bedside. That's obviously something that you can't replicate with a computer. So I think, we throw out the term hybrid and just we don't stop there as a hospital, but sometimes the industry just says, oh, it's hybrid, and I think, the hybrid, creating the optimal hybrid state from everything from who returns to work physically, working models, who's remote, who's on site, in the world, I think is finding that optimal mix is a struggle, particularly in healthcare though. When we say we have a hybrid optimal model of telehealth versus inpatient care, in-person care, I think that there's a lot of work that needs to be done as an industry to really determine what the best thing for the patient experience is. A lot of medical consults can be done over telehealth. Some you actually need to touch the person. So, all of those nuances, really, I think the industry needs to come together with, deliberate attention to not just settle and say, oh, yeah, it's hybrid, but to say, when we deploy the telehealth solution, and that's the correct for the patient experience, and when we need to deploy an in-person experience that's appropriate for the patient, provided that everything is safe from an infection control perspective.
Yeah, I think that's a great point. Oftentimes people say, well, we should just be able to get care over our phone. And having had several circumstances where you needed to be seen, sometimes in-person care is what you absolutely need. And so I think I agree, the long-term model will be some kind of a more sophisticated hybrid than what we're calling hybrid right now. Over the past couple days, the actions of Simone Biles has really caught our attention and our support when you think about mental health support, and realizing that even the greatest of champions have issues that they're facing and need our support. And Esther, there's especially been a lot of discussion around this for the frontline workers experiencing PTSD from the pandemic. In response to the enormous stress that doctors, nurses, technicians, and frankly, all hospital workers have gone through, are there things that you are looking to do differently on the operations front? And are you seeing similar responses from other hospitals?
Absolutely. I think we're headed in the right direction, but there's a ton of work still yet to be done. I'd say our priority here as a leadership team has really been to focus on all of our staff, making sure when they come to work, the systems are conducive so that they have the least amount of stress while they're at work. We've instituted things like de-stress rooms throughout the hospital where staff can go and have just some quiet time, some respite, putting things in there like massage chairs or different incense, things that just help people just reconnect and just mellow down before they have to go back and caring for patients. So we've done components like that. And then in addition, we are about to embark on a program where we pour back into our directors and our managers as well, because they really have to pour back into the frontline staff and make sure of their well-being. So doing things like, healthy meals for our leadership teams so that they can take it home to their families and not have to worry about cooking for a day, deploying housekeeping or maid services to their homes so that we can just help care for things outside of work that may relieve their ability to just clear their heads a bit. And then we've always had at this organization a program called an employee assistance program, where we have counselors available for our staff that are free of charge. And so we've actually leveraged those resources and actually brought in some specialists into the hospital and allowed staff to have time to talk to folks. So there's a variety of strategies that we've been leaning on, and I definitely have seen similar activities with some of our other hospitals.
That's awesome. I think any support that can be given is so it's just incredible. Thank you all for doing that. For everyone, the pandemic obviously has brought about scenarios where you immediately see something and think, wow, this really needs to change. What have you seen that you saw this really needs to change, and What are you all doing to try and make that happen? And full disclosure, I will say the obvious first answer is implement Care+Wear patient gowns and other products throughout your hospitals, but I'll save you all the words and just say that for you so we can move on with other items that you've seen while we really need to change. But yeah, love to hear one or two things that you're really focused on implementing throughout your hospital.
I guess I can start. Paul kind of alluded to earlier, we've seen kind of a pivot in the healthcare structure and folks that can be seen and utilized by telehealth or other kind of providers has seen kind of more of a focus in the post-COVID world. I think I find more people are being evaluated by their primary care physician through telehealth before just coming to the emergency department. Likewise, we're seeing telehealth kind of being used for follow-up and as a way to kind of establish care with folks. And I think I kind of alluded to before, I think people are taking more of an interest in their own health and actually seeking care and trying to establish care with primary care physicians in the post-COVID time as compared to in the pre-COVID world, which I think has actually kind of helped work and kind of hopefully will help improve things overall.
I think also there will be increased opportunity for technology collaboration with healthcare systems. I think not knowing what COVID's going to do in terms of optimizing the patient experience as remotely as possible, but with as much high touch, high service, I think is going to be essential. And we've started looking at different collaborations with industry experts that can help us achieve that, next level patient experience when the amount of interaction in person is continuing to be limited.
Yeah, I think for the the patient in terms of just in terms of technology, I think we have to deploy a lot of technology quickly, and it's by design. Every company has their technology and they want to sell their technology, so it happens. But for the end user, as the tech world calls those on the front line, for the frontline clinical staff that are caring for the patient, that technology coming might solve one specific use case, but then you end up with 5 to 10 different pieces of technology wherever you are that don't necessarily talk to each other and actually perhaps make the job a little bit harder for the frontline clinician, because now they have all these things that they need to put together themselves because the tech didn't do it for them. And so I think that needs to change. And I think it was magnified during the pandemic because we had to install telehealth solutions quickly. We had to install a lot of things quickly, and now we're trying to determine how they optimally go together, but that's just magnified that inherent problem in healthcare. It happens in other industries too, but healthcare specifically, there hasn't been really consolidation of technology around certain platforms other than the EHR, but all the ancillary ones are kind of on their own.
Yeah, it's interesting. I hosted a dinner last night for this New York City group of healthcare entrepreneurs and administrators. And one of the big things we were talking about was, in fact, Paul, EHR and integration into Epic. And one of the guys who had a very early stage startup was like, yeah, it's crazy. Epic already approved us, and someone else who works for a company that's Series D has raised over $1 billion was like, we're still not approved to work with Epic. And so it kind of magnifies that disparities that you're talking about and some of the work that still needs to be done. Greg, I know you, and by the way, everyone, we have just posted a quick poll to talk about kind of what healthcare issue has been the most important for you. So if you could take a second and vote, then we can share the results with you. Greg, you were kind of talking a little bit about how telehealth has become kind of the first path of action when going to emergency response. As you start to reimagine a continued path forward for emergency response after COVID, are you looking at staffing, at benefits, supply chains, or anything else differently? And kind of what are the learnings that you've learned from COVID that you're trying to carry forward?
Sorry, I was on mute. So I think COVID is kind of, at least kind of the frontline kind of ER workers, we've all kind of realized that we have to focus on staff safety also. You know, before I was routinely, I mean, pre-COVID, I can think of only a handful of times when I was wearing masks in patients' rooms kind of prospectively. As the ER doctor, I'm usually the guy figuring out what's going on with them. So routinely, we are not kind of prospectively covered kind of head to toe. I think COVID has kind of at least shifted the focus into kind of looking at the healthcare staff and making sure that they're protected so that we don't kind of bring things home to our friends and family and such. Talking with a lot of my colleagues, I'm not sure how long that we're going to be masked at work, and I'm probably going to be masked at work potentially the rest of my career, but honestly, none of us are sure, and I guess we'll see kind of what the future holds. I think staffing is a moving variable. I think we've seen with COVID over the last 18 months or so, kind of the rise and fall with hospital volumes kind of plummeting and then skyrocketing and having significant capacity issues. So of course, you know, the physicians, the hospital leadership and such are all kind of constantly reevaluating our supply chain. As we recall, early on, PPE was a significant shortage. And then early on, the CDC said we could wear handkerchiefs over our mouth while, you know, seeing images on the news of everyone else covered head to toe. Thankfully, at least in my shop, we never really had significant PPE constraints, thankfully. But I mean, you saw stories kind of across the nation of PPE supplies kind of being very variable. So I feel like there'll at least be a kind of push towards maintaining those supplies kind of going forward. But it's hard to plan for an emergency, right? Like we can all imagine every day there's something that could be potentially catastrophic that could occur. And it's hard to plan prospectively for that. But we do our best kind of going forward. And that's kind of what we prepare and train for.
Yeah, I think in speaking with a number of hospitals, I've heard firsthand similar comments to you of we can't really prepare, but we can have a stockpile of PPE. We can kind of be able to, Paul mentioned earlier about just how quickly people were implementing solutions and moving. And it's one of the big things that I always talk about that really didn't hit the press, but was super impressive, was the speed of action that all these hospital systems undertook to really to find solutions and make answers. I remember when the pandemic started and I was getting phone calls from CEOs left and right of every hospital. And that first weekend, I think I ate breakfast at 7 p.m. and had started my day at 4 a.m. And it was all leaders calling and saying, how can we protect? We need to buy things. We know there's a ton of scams out there. What can we do to make sure that our workers are protected? And it's been really impressive to see that response. Paul, I know one of the things you like to do in your spare time is help the nursing profession and really magnify the work that that's being done and helping strategize how it can move forward. When you think about care in general, what is the future of care in your eyes?
Yeah, so yeah, I'm very passionate about this. You know, I was a derivatives trader on Wall Street before I became a nurse, and that job just
pretty standard career progression.
Yeah,
it sounds like.
There's 3 monitors, you know, and I clicked away and traded the derivatives, and I wanted to do something different. And then when I became a nurse, I realized, well, there's a lot of clicking in this too. And so, you know, I think there's a lot of well-intended technology that's deployed in healthcare that's necessary for charting, documentation, regulatory purposes, all of the above. But a lot of that burden falls on the frontline clinician, and they're prevented from, that's sort of a barrier to caring in the way that a frontline clinician wants to care. They want to spend time with patients. They want to be there for them during their time of need. That's why people go into the profession. And so it seems like a lot of barriers just get in the way of that. And so I think the future of care is really eliminating those barriers so that all they need to do is care again, which is the most important job. And I think, you know, that comes from, there's all kinds of technology currently being created to be able to do this, automated charting, audio analysis. There's a whole host of things that are coming to the market. But I think anything that allows Greg and the frontline, you know, other frontline caregivers to care more is technology should be top of mind, because that is that's what really drives the patient experience. That's what people remember when you go to the hospital. That's what you need is someone there. And those barriers should be removed. So I think that happens, as I talked about a little bit earlier, with nurses stepping into new roles, leading, innovation, leading in the political sector, not just nurses, but all frontline clinicians, to really drive this, for the industry, so that future is brought to reality, so that they're able to care the way they want to.
I love that. It's so true. Esther, one quick question for you. And you kind of alluded to this a bit before we started the panel, as we were talking about preventative care and elective surgeries kind of being put on hold until vaccination rates had increased. And now you're starting to have calls from doctors and fellows saying that hey, we're starting to see more and more patients. As these procedures and treatments are resuming, how are hospitals rethinking the experiences of those receiving this care?
I think it's really communicating. I think maybe Greg mentioned this, is communicating and instilling confidence in our patients that the hospital is safe and that they're going to receive good care and that they're not at major risk of exposure. So I think there's different considerations to make sure that patients come into the organization with good confidence and with ease. And really, I think it's figuring out how to consolidate everything that's required from a patient optimization perspective prior to the day of surgery. There's a lot of activity that is required for a patient to be ready for their surgery, and trying to limit the amount of places they have to go to and the amount of times they have to come into the hospital. And so just, I think it's really the refinement of the whole system, to be honest.
I love that. So that kind of leads nicely into our next question, something that is near and dear to Care+Wear, and something that honestly is super important for us to all be thinking about and thinking about how we can improve. But if you could help design something else that would improve life for your clinicians or your patients, what would it be? And my team, by the way, is furiously going to be taking notes as you talk, so no pressure here.
I guess I can go first. I mean, as the frontline ER physician, a comfortable N95 mask, and N95 is a respirator that filters out most of the COVID particles. They are very necessary. I wear them in any kind of highly infectious environment and such. But a lot of them have a very tight fit, which they need to have a tight fit, but wearing those over 8-hour shifts, 10-hour shifts, 12-hour shifts, multiple times a day. So if there could be some workaround to a more comfortable N95, I think would be interesting. That would be well kind of embraced and liked by clinicians.
I would say, I don't know what our frontline staff would say if they heard me say this, but I think I would like to bring the fanny pack back. I think the clinicians in our frontline teams always see their little things in their pockets, scissors, pens, they're carrying their phones, the communication devices. I think if you could come up with something where it was comfortable, they could have everything in one spot, it might just make their day a little bit better and fun.
We'll have to connect offline, because our new scrubs aim to solve that issue without having to bring the fanny pack back. So maybe saving you some costs there too. Paul, how about you?
Yeah, no, I mean, I should have gone first, because those are two good ones. Is it narrow specific to something you would make, Chad, or
no, anything?
Oh, okay. Yeah, I mean, I think
world is your oyster.
To before, and I'm thinking as a patient, I have heart disease. I'm pretty public about it. I've had a stroke in the past, and just as a person who monitors my health, and Greg just alluded to this, I think there's so many different apps out there that help me track my health that I don't even know which one to get. And I think if there was just a comprehensive thing that helped me track multiple aspects of my own health, I think that would be great for me as a patient, and would be great for the healthcare industry. I spoke about it before with the fragmentation. It's like you could do this one for this part, this one for that part, and before you know it, you have all these apps, and it kind of defeats the purpose of one spot to track your health. So I think, as Greg mentioned, people really want to track their health and monitor it better, and something that just made sense where all of it was in one spot would be helpful. And there's companies trying to do this, but there's still a lot of them.
It's actually a great point. I sit on a board for NYU, and at the dinner last night, we were all talking about how they're doing a pre-diabetes study, and because they couldn't get enough people to sign up, they had all the board members sign up. And so now I wear a Fitbit, I use Noom to track every meal. And someone sitting next to me was using another company to track what they were doing. Someone else was using MyFitnessPal. I use MapMyRun. It's like 5 billion different things out there. And it's, to your point, why can't we just create one central compository? And I know Apple has tried to do that. And I guess some pundits would argue that part of their valuation is based off of Apple eventually just owning the whole healthcare ecosystem for tracking. But I agree, if there was just something nice and easy that you could do, I think it would be super, super important.
Yeah. And not to clarify, I'm not pro monopoly.
Totally.
Just as a patient perspective, it would be nice for some consolidation. But from a business perspective, it's nice to have some competition. So I'll leave that to someone else to solve, but it would be nice.
You just didn't want people to think in your derivatives trading days that you were really only going after monopolies.
Yeah, that's correct.
Great. Well, I know earlier we talked about what was the biggest healthcare issue that's been the most important to you in light of the pandemic. And most of you voted for innovation in healthcare as your top choice, with telemedicine and affordability and access tying for second. So for the first question from the crowd, this one's a nice one, but what is one thing that you wish the general public knew about hospitals and healthcare? It's really loaded there. Paul, why don't we start with you this time, so you can't give the excuse that the other two gave your answer?
Yeah. I think that they're full of people who are dedicated and skilled to do the best they can to help. I think there's a lot of people just with so much information that forget perhaps sometimes that there are experts in this area. For example, if I was to go to an emergency department, I'd rather have Greg take care of me than you, Chat, right? So I mean, that's not offensive to you, but
I mean, it's somewhat offensive, but I would probably do the same thing.
So I think he's the expert, and I think that level of deference I think is good. Also, conversely, that we're all humans and that the patient needs to be treated with ultimate respect, as that's why we're all there. So I think that dynamic, I think in times of fear, sometimes gets a little bit lost sometimes, and I think people all around just forget that we're all human beings trying to all do the best we can, and I think on every side of everything, and I think that's I've seen there's just wonderful patients, wonderful caregivers. It's a wonderful place to see, like I said before, the best of humanity, and I think sometimes I wish people sometimes all just realize that that's what we all were doing, which is just trying to bring out the best in humanity, care for people during their time of need. That is the point. It's not telehealth's not the point, or wearing a mask isn't the point. The fundamental point of it all is that, and I think people need to lead with that, both within the industry and the patients come all around. We need to lead with that more.
I love that. And I know one thing that you and your team have always talked to me about is how you want people to feel more like they're going into a hotel than a hospital and being treated like a customer rather than a patient. And I think that mentality you're seeing around the world, especially around the US, as more and more people are hired for a patient experience role and they're coming from the hoteling industry. Greg, sorry, I cut you off. Why don't you go ahead?
So going back to the question, kind of what is one thing that the general public knew about the hospitals and healthcare workers, I think kind of to echo what Paul said, we're all human. We all show up to work every single day. We all went into this profession because we want to help people. In the end of the day, I love my job. I see as the ER doctor, everyone I see as the ER doctor is having a bad day, right? Nobody plans to go to the hospital. Nobody plans to go to the emergency department. So in the end, I think folks need to realize that at least when it comes to the hospital and the healthcare workers, that we're all there to do our job. We all chose this profession. Paul pivoted from working on Wall Street to going into healthcare because, we all decided that we wanted to help our fellow human and such. And I think that is kind of the big thing that we realize, that we're all there to kind of help people. At the same time, I see people on their worst day when they're the most stressed, most feared, most anxious, and a lot of emotions we see in the emergency department. A lot of us have thick skins and we've kind of become used to that. But I think realizing ultimately that, the hospital is there to kind of help and focused on their care and get folks better.
I totally agree with both of what you said. And I'd say that currently the hospitals and healthcare systems are going through something that's unprecedented, and something that people that have been in this industry for 60 years have said they've never experienced something like this. And so I do think that it's important that for people to know, and it's hard because people expect hospitals and healthcare to kind of always be put together and always kind of have their act straight, but we're all sort of rebuilding and redefining how things are delivered, and ultimately the patient care component will never change, but there's a lot that's in transition. And I think, just to maybe Paul's point, to just have a little grace and assume the best in people and assume the best in the organizations.
Yeah, it's a great point. And I think one thing we talk about at Care+Wear is when we have people reaching out to us, to remember that they aren't necessarily having a great day and to be respectful of that. But I think even as patients, when we're in the hospital, we're all terrified, we're all nervous, etc. But just to be able to say thanks, right? Like, everyone is trying their best and trying to solve your problem. And I think that's one thing that unfortunately sometimes gets overlooked in the heat of the situation. So on behalf of everyone that's ever been in any of your hospitals, thank you all, to you and your staff, for everything that you all do. Greg, this question is specifically for you. And I don't know the answer because, as Paul alluded to, he would rather go to you than to me in the emergency room. But what do you believe is one of the biggest challenges of being an ER doctor? And this can either be pre or post-pandemic. You're on mute.
Thank you.
Technology apparently is one of the biggest challenges.
The biggest challenges that we're facing right now, that we've kind of talked to you before, is right now our hospitals are seeing impressive volume of folks coming to the hospital. So in the ER is all about flow, bringing people in, safely assessing them and moving them to a safe disposition, whether they can be discharged to follow up with their primary care doctor or whether they need to get admitted to the hospital. And any kind of fluctuations in that ecosystem kind of ends up getting compounded in the emergency department. And then we have problems with flow. We have people getting out of the hospital upstairs, getting to a nursing home, getting to kind of safe, closed PCP follow-up. So I think kind of managing the post-COVID volume that we're seeing is a challenge that's being experienced by facilities and ERs and hospitals kind of across the nation.
Totally. Here's a good question from the crowd. Do you think that COVID accelerated or hindered the adoption of value-based care? Esther, why don't we start with you on this one?
I don't think it really changed it, to be quite honest. I think it's still at the forefront of what we're looking to do, and we're always collaborating with stakeholders, trying to maximize a value. and improve quality of care. So I really can say, I don't think it's changed it.
Paul, have you seen any differences in New York?
I think, I don't, philosophically, I agree with Esther. I don't think there's been a philosophical change in terms of timing. I think where the focus is in terms of some metrics, obviously infection prevention has more of an awareness. So I think there's some within the overall umbrella of that, the metrics that are used to measure value-based care, I think some accelerated, some decelerated, but I don't think overall the philosophy has shifted.
Great. And Greg, any differences for you?
I mean, we've all been held to the same standard of care going through this entire process. I don't think there's been any kind of big differences or change, at least that I've seen in the emergency department.
Great. Thank you all for being a part of today's discussion, and to our audience, we really hope that this was not only informative, but leaves you thinking about healthcare differently. And don't forget to say thank you to anyone when you are in a hospital. Our goal with these discussions is really to bring together the amazing minds within our network of clinicians, manufacturers, designers, and more, to bring about and create more innovation within the healthcare space. We'd love to hear from you and what you thought of this. Please feel free to reach out to us at events@careandwear.com with any additional questions. This discussion will also be available online later today, both on our website at careandwear.com, as well as on our YouTube channel at Care+Wear. For all the latest news on all things Care+Wear related, you can follow us on social media, Facebook, Twitter, Instagram, LinkedIn, Pinterest, and more. All are at Care+Wear. Thank you all again for spending your morning with us, and we look forward to hearing from you and seeing what we can do together to revolutionize healthcare. Thank you.